In this video, we shall talk about sex education for children. First of all, sex education is necessary to address the misconceptions that children might have about the sexual act. Adolescents might feel very insecure when they hear about the sexual act from their peers. This sort of insecurity may lead to lack of confidence in the future, and therefore it should be addressed. Children and adolescents have a natural curiosity about genitalia and the sexual act. It is therefore better to address this curiosity at an early age, rather than leave it till very late when they are likely to find out about sexual act from other sources. Children and young people should also know about the consequences of sexual act. We shall look into these later. Sexual abuse is rampant in our society, but it is under-recognized and not addressed as it should be. Therefore, early education on the possibilities of sexual abuse is very important for children. The issue of consent is very important as far as the sexual act goes. We need to teach young people about what is involved in consensual sex and what is not acceptable. So what is the right age to give sex education? I find that the biological age is not a very good parameter. This is because different children grow at a different rate and therefore mature at a different age. Rather than the biological age, it is better to look at the stage of development of the child and then decide what kind of education would be suitable. For example, just before school-going age is probably the right time to talk about child sexual abuse. When your child attains puberty, it is probably the right time to talk about the physical aspects of gender and sex, that is about the male and female genitalia, menstruation, and the nature of the sexual act. Of course, puberty may be easily recognized in girls when they attain menarche. In boys, you might have to observe for the signs of sexual maturity, such as the deepening of voice and development of facial hair. Late adolescence or early youth is probably the right time to talk about the emotional aspects and the relationship issues that may be involved in a physical relationship. It is important for young people to realize that character assessment and good relationship is required before they embark on physical relationships with anybody. It is also the right age to talk about consensual sex, the right to say yes or no to a sexual act, and the need to honor the other person's decision. So, who should be doing sex education? I always find that parents shy away from addressing these issues with their children, but it is probably better for parents to do it than someone else. Because in today's age, information is available at the click of a button, and children are always interacting with their peers. So they may be exposed to misinformation and misconceptions from both these sources. If these are not addressed at an early age, then it can lead to later problems. So it's better that the parents remain in control about the overall education of their child, which also includes sex education. Both the parents can do it together or either one of them. It does not have to be gender matched, that is, a father need not have to do sex education to his son and a mother to her daughter. It can be the other way around as well, as long as the two individuals feel comfortable talking about these issues with each other. This is my list of things to be included in sex education: genital anatomy, genital physiology, sexual stages, consequences of sexual act, precautions to be taken, consent for sex, masturbation, and any sexual deviances. We shall look at each one of these now. Genital anatomy means the structures of the genitalia. Obviously, these are different in men and women. You can use pictures such as these to talk about your child about the male and female genitalia. It is better to familiarize yourself with the various parts of the genitalia. You might have to highlight the main differences between the male and female genitalia. For example, the sperm producing organ, that is the testis, lies outside the body in a man, whereas the egg producing organ, that is the ovary, lies inside the body of a woman. Women have vagina, which is like a receptacle for the semen that comes out of the male sexual organ, that is the penis. This happens during sexual union, and the semen proceeds upwards in the female genital tract to unite with the egg to form the embryo. The embryo or the developing fetus is then attached to the uterine wall in which the baby develops. In addition to these pictures, you might also want to consider using dolls, that is a male and a female doll, to explain to your child about what is involved in the sexual act. We shall now talk about genital physiology, that is nothing but the normal functions of the male and female genitalia. In particular, you need to talk about menstruation, which occurs in women. You can make use of these simple pictures to make your child understand about the process of menstruation. Once again, familiarize yourself with all the terminologies involved in the menstrual cycle. On average, it runs for 28 days. The first day of menstrual bleeding is considered to be day 1 of the cycle. And in a 28-day cycle, the 14th day is usually the time when the egg is released or ovulation occurs. So a few days before this ovulation and a few days after this ovulation is what is known as the fertile period, because during this time, if the sperm meets the egg, it results in fertilization or conception. You might also want to teach your girl child about menstrual hygiene and the need to have good nutritious food rich in iron so that the effects of regular blood loss may be countered. In boys, when they attain puberty, sperms are produced in the testes, and these are ejaculated in the semen during orgasm or climax. Let us now consider the sexual stages, that is the cyclical nature of the normal sexual act. Initially, there is desire, or what is known as libido. During this stage, there is an urge to indulge in the sexual act. This leads to arousal or excitement. During this stage, there could be bodily or physiological changes such as quickening of the pulse, shallow breath. This leads to further excitement. Actual sexual contact between two individuals involving the penetration also occurs during arousal. Repetitive penetration then leads to the next stage, which is orgasm, also known as climax. This is when the penis ejaculates the semen into the vagina. After this, there is what is known as the refractory period or resolution, when the urges and excitement reduce and the situation reaches a baseline once again. It is important to remember that the refractory period may be long in men, which means going back to the desire stage is delayed by few hours to days in men, whereas the refractory period may be absent in women, which means that they can go through the desire to arousal to orgasm phase repeatedly, which is why they are capable of having multiple orgasms. It is also important to remember that these sexual stages are generic. That means it is not just applicable to heteronormative sex, but also to other variations of the sexual act. Consequences of the sexual act. It may result in unwanted pregnancies, especially if protection is not used. If the partner has a genital disease, then this may be sexually transmitted to the other partner. Some examples of sexually transmitted diseases include hepatitis, syphilis, gonorrhea, and HIV infection. Sexual exploitation is also very common. One of the partners may surreptitiously take pictures or make videos of the sexual act. This can then be used to blackmail the other partner for financial or further sexual gains. Therefore, certain precautions have to be taken before and during the sexual act. One of the simplest things to do is to practice safe sex, that is, contraception has to be used, such as condoms or oral contraceptive pills. These can prevent unwanted pregnancies, and condoms can also prevent sexually transmitted diseases to a large extent. It is also important for young people to remember that assessing the character is very important before they say yes to the sexual act. They should give consent to the sexual act only if they are completely satisfied that the other partner actually cares for them and is respectful of their decisions. Like for any other act or procedure, consent for sex is also necessary. Full consent is necessary before consummation occurs. It is important to remember that any partner can say no to the sexual act. They can also change their mind later on and say no before they proceed with the sexual act. If one person says no, then the other partner should understand and accept this decision and not go ahead with the sexual act. Otherwise, this can be considered to be sexual assault or rape. Just a few words about masturbation. There are a lot of misconceptions about masturbation, such as it can lead to weakness and other diseases. It is usually done in conjunction with pornography use, such as viewing sexually exciting images or videos. It is important to remember that for single individuals, masturbation, if done in privacy and in moderation, is an acceptable practice and is not harmful, because it is natural to have sexual curiosity and urges, and if these are not released through masturbation, they may present at a later stage in more problematic ways, such as sexual frustration and assaults. On the other hand, excessive masturbation can be addictive and therefore harmful in the long run. What are sexual deviances? In this video, generally I have talked about heteronormative sex, that is, sexual contact between a man and a woman. It is important to remember that there are normal deviations from the usual sexual act. It is better for parents to have an open discussion about these with their children. Gender dysphoria, also known as transsexualism or gender identity disorder, may present itself during puberty or at the onset of sexual maturity. In some cases, it could present earlier when the child shows predilection for dresses and toys that are usually used by a child of the opposite gender. During puberty, this feeling may become stronger, and the individual may seek to live like the person of the opposite gender and also consider having gender reassignment surgery, that is, sex change operation. These issues have to be identified at an early age and addressed with the help of mental health professionals. Please remember that there is no definitive treatment for gender identity disorder. Likewise, homosexuality is also a normal variant of the usual sexual act. It is very important to remember that this is not a psychiatric disorder, therefore it cannot be treated. It is also useful to remember that homosexuality has been decriminalized in India. It is no longer a punishable offense. Therefore, if your child is sure about his or her gender orientation and sexual orientation, it is probably better to accept this situation and provide your support and understanding and guidance to the child so that they can become better adjusted with their gender and sexuality. I have written more about the various aspects of sex education in my blog, so for more information on this subject, please see the description of this video where you will find links to all these articles. Thank you for watching this video. Namaste.